warning tonight about Ontario's healthcare system. We all know that our healthcare is facing serious troubles, but a new report says some of those issues are going to be going on for a long time.
Now, this as the province continues to spend massive amounts of money on healthcare. Al Sweeney was at Queen's Park today and has the details.
The report was released by Ontario's Financial Accountability Office, which analyzes what's going on with the province's spending. It says if the province continues to spend money on healthcare the way it's doing now, healthcare spending will be short $21 billion by 2028.
There's the relentless reality that the population is growing and aging and will continue to create more and more demand.
The report says it could mean things like a massive shortage of 33,000 nurses and personal support workers by 2028, a shortage of hundreds of hospital beds, and not enough long-term care beds, among other things. The accountability officer says he's just the reporter and doesn't have the answers.
My job is to raise the questions and not have to answer them.
Leaving it up to politicians like Premier Doug Ford, who says he's already spending $75 billion a year on health care, with more to come, along with a plan for private surgical clinics.
So we're throwing everything in the kitchen sink at healthcare, but this is the reason we need to do things differently. This is the reason we got to get caught up on the backlog surgeries.
The opposition here at Queen's Park says the government maintains it's fixing the system. They say the government is part of the problem, with the idea of privatization in mind.
I think it was a devastating report and another example of how this government, despite making all these promises and releasing all these plans, isn't actually funding them properly and has created a crisis.
They pointed to pay for workers like nurses under the Ford government.
Ontario has the lowest paid nurses in Canada. So I'm not sure whether Doug Ford thinks that's a badge of honor. Not a great one to have on International Women's Day.
Ontario will not solve the healthcare crisis we're facing as long as we have the lowest paid nurses in the country and as long as we have the lowest per capita spending on healthcare in the country.
So the report says the staff shortage is a central issue. Without the staff, you can't provide the services. And the province needs tens of thousands more nurses and PSWs. But this report is based on projections, based on what we know now. If the province suddenly gets new money from someone like the federal government, for instance, things could change.